And you know, the nose surgery began in India, started by Sushruta in 800 BC, 5000 years back. The tools were something different. And with each passing years, our tools become more sophisticated so that we are more precise and better than what we were yesterday. So principle of piezo. Now what is this piezo? Piezo is based on ultrasound principle based cutting, and it is frequency based cutting. If let's say the bone density is higher, you can adjust the setting of this instrument so that it can precisely cut, and there is no heat or thermal damage that is there with your micromotor or drill. It precisely cuts your bone. Coming on to the advantages which I observed on my Indian patient, among these 400, 500 cases which I have done, I have not seen bruising in single patient of mine, no exaggeration. You can log into my Insta page, see my result. At 7 days, not a single patient developed bruising. Early recovery, why there was, and there is one advantage which I noticed, because our skin is thick. And once we try to elongate our nasal structure with adding cartilages, in piezo rhinoplasty, we do a complete subpericordial, subperiosteal, we do complete declubbing, and all the dissection is under. So it's like a complete skin flap. And when you create a new cartilaginous structure here, the skin flap will drape nicely. But if you just merely do dissection here, create a good cartilaginous support, the Indian thick skin is gonna, there's every chance that it's gonna rotate the tip up. But if you do a complete declubbing from here to here for piezo osteotomies, it will drape your cartilaginous structure in a better way, leading to lengthening of a short nose in a better way. Then the next point which I observed, that everything is done under direct vision. Symmetrical osteotomies, I generally get PD scan, CT scan of my patient. Every small detail that is on 3D CT scan, I am able to rasp the bony structure of the nose to precisely millimeter. Millimeter is a big diameter.